Circulatory system. 1. What is the circulatory system? The circulatory system is the network of organs and vessels responsible for transporting blood, oxygen, nutrients, and hormones throughout the body. 2. What are the main components of the circulatory system? The main components include the heart, blood vessels, and blood. 3. What is the primary function of the heart? The heart pumps blood throughout the body, delivering oxygen and nutrients while removing waste products. 4. What are the different types of blood vessels? Arteries carry oxygenated blood away from the heart, veins return deoxygenated blood to the heart, and capillaries connect arteries and veins, facilitating nutrient exchange. 5. What components make up blood? Blood consists of red blood cells, white blood cells, platelets, and plasma. 6. What is the purpose of red blood cells? Red blood cells contain hemoglobin, which carries oxygen from the lungs to the body's tissues and removes carbon dioxide. 7. What is the function of white blood cells? White blood cells are part of the immune system and help fight infections and diseases. 8. What do platelets do? Platelets aid in blood clotting, preventing excessive bleeding when injuries occur. 9. What is the pathway of blood flow through the heart? Blood flows into the right atrium, then to the right ventricle, into the pulmonary artery to the lungs, back to the heart through the pulmonary veins, and finally to the left atrium and left ventricle before being pumped out to the body. 10. What is systolic blood pressure? Systolic blood pressure is the highest pressure in the arteries when the heart contracts. 11. What is diastolic blood pressure? Diastolic blood pressure is the lowest pressure in the arteries when the heart relaxes. 12. What is the average resting heart rate for adults? The average resting heart rate for adults is between 60 to 100 beats per minute. 13. What is an electrocardiogram? An ECG is a test that records the electrical activity of the heart to diagnose heart problems. 14. What is atherosclerosis? Atherosclerosis is a condition where plaque builds up inside the arteries, causing them to narrow and potentially leading to heart disease or stroke. 15. What is hypertension? Hypertension, or high blood pressure, is a condition where the force of blood against artery walls is consistently too high, potentially causing health issues. 16. What is the lymphatic system? 16. What is the purpose of the lymphatic system in relation to the circulatory system? The lymphatic system works with the circulatory system to remove excess fluid, waste, and toxins from the body. 17. How does exercise affect the circulatory system? Exercise strengthens the heart, improves blood circulation, and increases the efficiency of oxygen delivery to tissues. 18. What are some common symptoms of circulatory system disorders? Symptoms include chest pain, shortness of breath, fatigue, dizziness, and swelling in the legs or extremities. 19. What are varicose veins? Varicose veins are enlarged, twisted veins that often occur in the legs due to weakened vein walls and valves. 20. How does smoking impact the circulatory system? Smoking damages blood vessels, increases the risk of atherosclerosis, and contributes to heart disease and stroke. 21. What is the role of the aorta in the circulatory system? The aorta is the body's largest artery, carrying oxygenated blood from the heart to the rest of the body. 22. What is the function of the sinoatrial node in the heart? The SAW node is the heart's natural pacemaker, initiating electrical impulses that regulate the heart's rhythm. 23. What is cardiac output? Cardiac output is the volume of blood pumped by the heart per minute and is calculated by multiplying heart rate by stroke volume. 24. What causes a heart attack? A heart attack occurs when a blockage in a coronary artery restricts blood flow to part of the heart, leading to tissue damage or death. 25. How does the body regulate blood pressure? The body regulates blood pressure through the nervous system, hormones like aldosterone and adrenaline, and the renin-angiotensin system. 26. What is the role of hemoglobin in blood? Hemoglobin is a protein in red blood cells that binds to oxygen in the lungs and transports it to tissues throughout the body. 27. What is the function of the pulmonary veins? Pulmonary veins carry oxygenated blood from the lungs back to the heart. 28. What is the purpose of the coronary arteries? Coronary arteries supply oxygenated blood to the heart muscle itself. 29. How does the body regulate body temperature through the circulatory system? The circulatory system helps regulate body temperature by redistributing heat throughout the body and releasing excess heat through the skin. 30. What is the purpose of a pacemaker in the context of the circulatory system? A pacemaker is a medical device that helps control abnormal heart rhythms by sending electrical impulses to the heart to maintain a regular heartbeat. 31. What is angina? Angina is chest pain or discomfort caused by reduced blood flow to the heart muscle. 32. How does the body maintain a balance between clotting and bleeding? The body uses a complex system involving platelets, clotting factors, and anticoagulants to regulate clot formation and prevent excessive bleeding. 33. What is the purpose of the endothelium in blood vessels? The endothelium is the inner lining of blood vessels that regulates vascular tone, blood clotting, and immune responses. 34. How does the body compensate for changes in altitude in relation to the circulatory system? At higher altitudes, the body increases heart rate and breathing rate to deliver more oxygen to tissues due to reduced oxygen levels in the air. 35. What is the role of the spleen in the circulatory system? The spleen filters blood, removes old or damaged blood cells, and helps fight infections by producing white blood cells. 36. What is the difference between pulmonary circulation and systemic circulation? Pulmonary circulation involves the movement of blood between the heart and lungs, while systemic circulation involves the movement of blood between the heart and the rest of the body. 37. What causes a stroke? A stroke occurs when blood flow to part of the brain is disrupted, either by a blockage or a blood vessel rupture, leading to brain damage. 38. How does the body respond to dehydration in terms of the circulatory system? Dehydration can lead to decreased blood volume, which in turn affects blood pressure and the ability to deliver nutrients and oxygen. 39. What is the function of the vena cava in the circulatory system? The vena cava is the largest vein in the body, responsible for returning deoxygenated blood from the body to the right atrium of the heart. 40. How does the circulatory system change with age? With age, blood vessels can stiffen, blood pressure may rise, and the heart's efficiency may decrease, increasing the risk of cardiovascular diseases. 41. What is vasodilation and vasoconstriction? Vasodilation is the widening of blood vessels, allowing increased blood flow, while vasoconstriction is the narrowing of blood vessels, reducing blood flow. 42. What is the difference between a heart attack and cardiac arrest? A heart attack occurs due to a blocked artery, restricting blood flow to the heart, while cardiac arrest is a sudden loss of heart function, often due to an electrical disturbance in the heart. 43. What is the role of cholesterol in the circulatory system? Cholesterol is a lipid that is necessary for building cells, but high levels of LDL cholesterol can contribute to plaque formation in arteries, leading to atherosclerosis. 44. What are the risk factors for developing circulatory system disorders? Risk factors include high blood pressure, high cholesterol, smoking, diabetes, obesity, a sedentary lifestyle, and a family history of heart disease. 45. What is peripheral artery disease? Peripheral artery disease is a circulatory condition where narrowed arteries reduce blood flow to the limbs, leading to symptoms like leg pain, numbness, or weakness. 46. How does the body respond to shock in terms of the circulatory system? In shock, the body tries to maintain blood flow to vital organs by constricting blood vessels, increasing heart rate, and redistributing blood from less critical areas to essential organs. 47. What is the purpose of the cardiac cycle in the circulatory system? The cardiac cycle refers to the sequence of events in which the heart contracts and relaxes to pump blood through the circulatory system. 48. What are the differences between the fetal and adult circulatory systems? In the fetal circulatory system, oxygenated blood comes from the placenta through the umbilical vein, bypasses the lungs via the ductus arteriosus and foramen ovale, then returns to the placenta. After birth, these shunts close, redirecting blood flow through the lungs. 49. How do medications like anticoagulants or blood pressure medications impact the circulatory system? Anticoagulants help prevent blood clots, reducing the risk of stroke or heart attack, while blood pressure medications help regulate blood pressure, decreasing strain on the heart and blood vessels. 50. What is the role of nitric oxide in the circulatory system? Nitric oxide is a signaling molecule that helps blood vessels relax and dilate, improving blood flow and reducing blood pressure. These questions and answers cover various aspects of the circulatory system, including anatomy, function, disorders, treatments, and physiological responses.